As healthcare professionals, it is vital for us to be vigilant about the different cellular changes that can happen in the oral cavity, mainly because these cellular changes can help us with the early detection of cancer. Hello, I am Dr. Madrigal, and today we're going to be speaking about the different tools that are available to us that can help us with this quest. Specifically, we're going to be speaking about the ViziLite PRO and its biofluorescent technology. This biofluorescent technology can assist us in detecting even minor changes in the cells that are abnormal and can help us in detecting these early stages of cancer that may end up saving our patients' lives. So now let's go over the structure of the ViziLite PRO. We have two different sides. The smaller circle is going to be the viewing side, and the larger circle is going to contain 5 different lights. Now these 5 different LEDs are going to be violet short waves, which are going to generate the biofluorescence. That's going to allow us to see clearer all that mucosa and any cellular changes that we may find. We also have that green circle or the green button, and that's going to be the on and off button for the light. When we press it, the light will turn on. Press it again, it turns off. And it's that easy. Let's go ahead and take a look at our patient. Now we're ready to screen our patient. The first thing we need to do is protect her eyes. So we have special glasses that we're going to ask her to wear. And now we're going to prepare the ViziLite PRO by placing a plastic film in the side where we have the 5 different LED lights, as this will go towards the patient. So this film is going to have 2 different protection layers, which we're going to remove one, and then we are going to remove the second one, and we can now place it firmly on the ViziLite PRO. Once it's completely adjusted, we're now ready to screen our patient. So we're going to ask our patient first to open as big as possible. So open as big as possible, Giselle. With one of our fingers, we're going to pull her cheek, and we're now going to shine the light directly into the oral cavity. We ask the patient to say ah, again, and this way we're going to be inspecting all the soft palate. After we inspect the soft palate, we're now going to move on to the hard palate. We'll make sure everything's ready, everything's clean, and then we're going to go to the sides of the tongue. Now the sides of the tongue, we're going to be using a 2x2. So with this 2x2, we're going to grab the tongue and we're going to stick it out, move it to one side, and then move it to the other side, because we want to make sure that we see those lateral borders of the tongue. Thank you. So you want to stick your tongue out yourself? Okay. We're going to grab the tongue and we're going to move it to one side and now to the other side. Everything looks clean. And now we're going to ask the patient to raise her tongue to the roof of the mouth, because we want to see the underside of the tongue. Open. Perfect. So now that we inspected the soft palate, the hard palate, and underneath the tongue, as well as the lateral borders of the tongue, we are now going to inspect the lower lips and the upper lips. Open this up. As we retract, we want to make sure that we look for any areas that are going to be turning dark. And everything looks clear. And that's it. That concludes our inspection.